Nowadays, I think that a lot of teenagers are well aware of the benefits of cosmetic surgery. And I suppose during those years, during those teenage years, you tend to become a bit more aware of your body, and you're watching it develop and create itself. And in those years, many young girls, for example, will be very well aware of their breasts. And so they expect the breast to enlarge and become more womanly. The thing is, of course, not everybody is created equal, and some women will develop and others won't. And so in those situations, it's inevitable you're going to get young teenagers, particularly the ones who haven't developed as well, to want to have cosmetic surgery. Now, in general, as a plastic surgeon, I usually like to wait until a person is 18 or 19 before deciding whether any surgery is appropriate. The reason being is because you're still developing. As we all know, we all develop at a different rate and different speed. And so, although a young girl could be developed at the age of 14, others take a little bit longer. So we want to make sure that we're not going to interfere with any development before we start doing some surgery. Now, at around the age of 18 or 19, that's a time when we can start discussing possible, for example, breast augmentation, if that's appropriate. The problem is that even at that age, I'm a little bit reluctant to jump in straight away. The reason being is, although technically speaking, it's certainly feasible to perform breast augmentation at that age, I like to be sure that the person has thought about this very carefully and is mature enough in their own mind to handle any possible downsides that come with surgery, because we have to understand that surgery, no matter how sort of often we do it, there are always possible complications that could arise. And so you got to be sure that, should in the event that this happens, that you're able to handle those quite maturely. And so what I normally do is I normally ask a person who is considering surgery to come to have a chat with me, and then we go through all those the benefits as well as the possible downsides. And then I ask them to go away to have a think about that and make sure they really deeply understand everything we've talked about, and come back to me if there are any other sort of questions or problems. Once I'm sure, once they've had the time to consider this carefully, then maybe after maybe a second consultation, provided we're all happy with that and everybody understands the possible sort of downsides as well, I could then recommend a breast augmentation. One of the exceptions with respect to teenage surgery, an operation that we actually do younger, is a rhinoplasty, or nose job. Now, the reason is that we can actually do a rhinoplasty at the age of anytime from about 15 onwards. The main reason is that the development has finished by the age of 15 in all individuals, and so the nose is not going to change anymore. And so if we're not happy with the shape of the nose, then we can recommend a rhinoplasty procedure. I think it's quite important perhaps to deal with this early on rather than later, because it can lead to quite intense psychological problems for an individual who's got a particularly unsightly nose. So in order to avoid all that psychology that goes along with having that, it's sometimes better to deal with it earlier rather than later. And so in those situations when an individual is 15 and they're not happy with their nose, they usually come to my rooms with parents, of course, so we can all talk about it and discuss it and understand exactly what the issue is and what they're not happy with. And I'll go through that with them and explain to them what a procedure or what a surgery can do to them, as well as covering any possible downsides and side effects. Providing we're all happy with that, then certainly I can undertake this procedure in a young individual as young as 15 or 16.